Okay, so we're going to go ahead and perform the Thomas test, and I'm just going to kind of take you through a little scenario of what it would look like in a practical. So come in, wash my hands. Hello, Ms. Johnson.
Hello.
Hi, how you doing today?
I'm well. How are you?
Great. My name is Matt. I'm going to be your physical therapist today. I understand that you're having some knee pain, some hip pain. Is that right?
Yeah, it's a little tight. It's on my left side.
Okay, well, I definitely want to go ahead and take you through a little assessment called the Thomas test. It's just going to basically assess your overall muscle length down there, and then we can kind of determine what's tight and what we need to focus on. Does that sound okay?
Yes.
Okay. So what you would do first is you'd have the patient right here, but along the edge of the bed, right there. We don't have a high-low table, but you would adjust it to where the height of the table is just under the gluteal fold. So she'll kind of sit back a little bit like she's attempting to sit down. I'm going to test her right side, so I'm going to ask the patient to grab her left leg first while she's sitting on the edge of the table.
As you're supporting her back.
Exactly.
Okay.
And so what you're going to do is...
So you're testing your right side?
Yes, testing her right side.
Okay.
So PTs, use good mechanics, and then you're just going to gently lower her back, supporting the opposite limb. So we'll pretend that I adjusted the height. It's probably a bad example of a table. Okay, so she's going to hold her knee right here. Now if the patient has trouble doing that, or if they're having to compensate, you can give them a strap right behind their leg and they can hold their knee in place like that. Want to make sure that the knee is either just over the ASIS or maybe just slightly past, so where she's not compensating her spinal mechanics. So we're looking to make sure the low back is flat, sacrum is flat. To do the test, what I'm going to do is I'm going to bend the opposite knee, bring it up towards her, right about here. I'm going to cradle the knee like that, making sure the leg is nice and relaxed. So go ahead and just relax for me if you can. Now, I'm going to get into a good AP stance, and I'm going to place my stabilizing hand, locate her ASIS. I'm going to stabilize in the direction of where the muscles are going. So in this case, I'm kind of just pushing down and forward. Now, what I'm going to do is let this leg in my right hand just passively lower down, still stabilizing the ASIS. Now, when she gets to a point where the ASIS is starting to roll forward in my hand, that's where we stop the test. So now what I got to do is determine if the back of her thigh is touching the table. I can see that back of the thigh is probably a few inches above the table. So what this is going to tell me is with the knee bent about 80 degrees of knee flexion, I know that there's going to be at least tightness in a one joint muscle. That's going to be the iliopsoas. Now to confirm a two joint tightness, what I'm going to do is extend the knee now and have her do the same thing. So, trying to figure out how to do this. Okay, so same thing, stabilize, keep that knee extended. We're going to let it lower down. So once again, the ASIS rolls into my hand and the back of the thigh is still above the table. So this confirms to me that there is also a two joint muscle involved. My guess is it may be TFL, and so what we can do to confirm that is perform the Ober test, which we can do in the next video.